You wake up and your mouth feels like it was packed with dry sawdust all night long. Thick, sticky, and deeply uncomfortable. You grab the water glass from your nightstand, take a sip, and move on without giving it a second thought. Just another morning. Just part of getting older, right? I need you to pause right there. Because that thought, that dismissal, that 5-second decision to brush it off and carry on, could be among the most consequential mistakes you make this entire year. I am Dr. Stanley Brown, and I have devoted decades to clinical practice watching patients explain away symptoms their bodies were desperately trying to communicate. Morning dry mouth is one of those symptoms. I understand how that sounds. Dry mouth. Not a heart attack, not chest pain, not something visibly alarming, just dry mouth. But stay with me, because by the time we are finished today, you are going to view that morning dryness in a completely different way. There is a chain reaction unfolding inside your body when this happens, and it begins long before you ever open your eyes. Understanding it will not simply make your mornings more comfortable. It could protect you from pneumonia, from infection spreading into your bloodstream, from losing teeth you have maintained for 70 years, from a decline nobody anticipated because everyone was looking elsewhere while the real problem was hiding in plain sight. This is not a trivial inconvenience. It is your body waving a red flag, and today I am going to show you exactly what to do about it. So let us begin at the very foundation. Let us talk about something most people have taken completely for granted their entire lives. Saliva. Nobody wakes up thinking about saliva. Nobody visits their doctor and asks how their saliva production is doing. It is simply there. It has always been there. And like most things that are always just there, people only notice it once it is gone. But once you truly understand what saliva actually does, what it is composed of, and what it is actively accomplishing inside your mouth every single hour of every single day, you will never regard it the same way again. Most people assume saliva is essentially diluted spit, something your mouth produces so food does not stick to your teeth. Something that appears when you smell something appealing. That assumption is wrong in roughly 15 different ways. Saliva is one of the most biologically sophisticated fluids your entire body manufactures. It is not water with a little something mixed in. It is a precisely engineered biological solution produced continuously around the clock in dedicated glands designed exclusively for this single function. And what it accomplishes is genuinely remarkable. Consider what it is doing every single hour of every single day. It is actively fighting. Your saliva is loaded with antimicrobial compounds, proteins called immunoglobulins, enzymes like lysozyme and lactoferrin, peptides most people have never encountered, all functioning together to identify and neutralize bacteria, viruses, and fungi before they gain a foothold anywhere. This is not passive. This is continuous active biological defense operating inside your mouth without a single conscious thought from you. Every time you swallow, and you do so hundreds of times daily without awareness, you are sending a protective wave through your mouth and dispatching those pathogens into the acidic environment of your stomach, where they are eliminated. Without sufficient saliva, that sweeping action does not occur. Bacteria are not moved along. They remain. They multiply. They establish colonies. And your mouth transforms into exactly the kind of environment that carries very unpleasant medical terminology. And it does not end there. Saliva represents the very beginning of digestion. It contains enzymes, amylase being the most significant, that begin breaking down carbohydrates the instant food enters your mouth. Before anything reaches your stomach, the process has already started. When you chew and saliva combines with your food, you are not simply softening things mechanically. You are initiating a chemical transformation. When saliva is diminished, that process is disrupted from the very first bite. Food arrives in your stomach less prepared than it should be. For older adults especially, where nutrient absorption is already carefully monitored, where stomach acid production has often naturally declined, where the entire digestive process operates less efficiently than it did at 30. That disruption at the very beginning carries more significance than most people appreciate. Saliva also maintains the pH balance inside your mouth. After eating, acid levels climb. Bacteria generate acid as a byproduct of processing food particles. Your enamel, the hard outer coating of your teeth, is vulnerable to that acid. Saliva neutralizes it, restores the environment to a safe range, and gives your teeth a genuine fighting chance. Without adequate saliva flow, that acid lingers against your enamel for extended periods. And that prolonged acid contact is precisely what initiates decay. People with dry mouth do not simply develop slightly more cavities. They can experience a rate of dental destruction that is genuinely shocking compared to what they previously knew. But here is what I most need you to understand. The specific reason morning dry mouth is so particularly dangerous. Saliva is what enables you to swallow safely. Think about that. Try it right now. Simply swallow. Notice how effortless and smooth that is. Notice how saliva coats everything and allows it to move in a coordinated, controlled manner. That is not accidental. That is biological engineering. Food needs to be formed into a cohesive, lubricated package that your throat muscles can direct in one clean, precise motion. Saliva creates that package. It binds food particles together, coats the surface, and allows the entire mass to travel through your throat and down your esophagus without incident. Now picture attempting to swallow dry bread, a piece of chicken, or a handful of granola in a mouth that has been completely dry for 8 straight hours. The food cannot form that cohesive, lubricated bundle. It fragments. It becomes loose and unpredictable. Pieces separate from the main mass. And that unpredictability, as I will explain shortly, is where the genuine danger lives. The medical term for chronic dry mouth is xerostomia, and it is not simply a description of how you feel. It is a measurable reduction in salivary output that strips your mouth of its primary defense system. Physicians can measure it. Salivary gland function can be formally tested, and when those numbers drop below a certain threshold, the consequences we are about to discuss become significantly more probable. Every night you sleep with your mouth drying out, you are sleeping without your guard in place. Your oral environment shifts from a carefully balanced ecosystem where various organisms coexist in managed equilibrium to something resembling an uncontrolled biological experiment where the most aggressive and destructive species take over, because the mechanism keeping them in check has vanished. That sticky morning sensation is not merely unpleasant. It is evidence. It is the physical proof left on your tongue and the roof of your mouth that your defenses were down all night and things were occurring in there that you would not want to witness under a microscope. So, what is actually responsible for this? Here is something important to understand. It is almost never a single factor. It is almost always a combination, a kind of perfect storm of contributing elements that stack upon one another and amplify each other's effects. And when you hear them, I believe you will recognize yourself in at least one or two of them, possibly more. The greatest culprit for most adults over 60 is medication. Not one specific drug, but the accumulation of medications. There are over 500 commonly prescribed drugs that list dry mouth as a documented side effect. 500. Blood pressure medications, antihistamines, antidepressants, anti-anxiety medications, muscle relaxants, bladder control medications, Parkinson's medications, certain pain relievers, some diabetes drugs, diuretics of multiple varieties. The list extends far beyond what most people expect, and here is what makes it genuinely complicated. Each medication individually might produce only mild dryness, a slight reduction that you might not consciously register. But when you are taking 3, 4, 5, sometimes 10 or more simultaneously, and that is entirely common for adults in their 60s, 70s, and 80s, those effects do not simply add together. They compound, they layer, they interact in ways that your various prescribing physicians, who often see you for different conditions in different offices on different days, may not be tracking as a unified picture. They interfere with the nerve signals instructing your salivary glands to produce. They alter the composition of whatever saliva is being generated. They affect blood flow to the gland tissue itself. Think of it like a factory where order forms keep getting misplaced, supply deliveries keep arriving late, and half the workforce has been reassigned elsewhere. The machinery exists, the capacity is there, but instructions are not arriving consistently. Raw materials are reduced, and production slows to a fraction of what it should be. Perhaps you have experienced something like this without connecting the dots. You had been on a medication for years with no oral complaints. Then a new prescription was added for something unrelated, and gradually, not overnight, mornings started feeling different. Drier, stickier. That gradual onset is precisely why it goes undetected. People do not connect the new medication to the new symptom, because the link develops slowly, and because dry mouth sounds so minor that nobody puts it at the top of their list of concerns. But it belongs there. It absolutely belongs there. The second major contributor is how you breathe during sleep. At night, you should be breathing through your nose. Your nasal passages are specifically designed for this purpose in ways your mouth simply is not. They filter incoming air, removing particles and pathogens. They warm air to body temperature before it reaches your airways. They add moisture to it. By the time air entering through your nose reaches your throat and lungs, it has been fully processed and conditioned. Your mouth bypasses all of that entirely. If you breathe through your mouth during sleep, whether due to seasonal or chronic nasal congestion, structural issues like a deviated septum, enlarged adenoids, severe allergies, or something more significant like obstructive sleep apnea, then for 7 or 8 hours every night, dry, unfiltered, unconditioned air is moving continuously across every moist surface inside your mouth. Picture leaving a shallow dish of water on a breezy windowsill on a dry afternoon and returning 8 hours later to find it nearly evaporated. That is essentially what is happening inside your mouth. Moisture is continuously being drawn out by constant airflow. The saliva that would normally coat and protect your oral tissues cannot keep pace with that evaporation. It dries up, and what remains is a warm, dark, increasingly parched space that anaerobic bacteria, the kind that flourish without moisture and generate the most harmful compounds, find absolutely ideal. Sleep apnea deserves specific attention here because it connects dry mouth to a much broader conversation about overnight health. People with untreated obstructive sleep apnea mouth breathe not by preference but because their airway is periodically collapsing during sleep. The body compensates by opening the mouth and working harder to draw in air. If you snore heavily, if you wake frequently during the night, if you feel unrested regardless of how many hours you slept, if someone has observed you appearing to stop breathing during sleep, the dry mouth you experience each morning may be one signal among several that something significant is occurring overnight and deserves proper evaluation. The third cause is something that cannot be resolved with a better bedtime routine or a glass of water. Sometimes dry mouth is not a side effect of something else. It is a primary symptom, a direct result of a condition actively affecting your body that requires its own dedicated attention. Diabetes is probably the most common and most significant example. When blood sugar is inadequately controlled, the impact reaches every system in the body, and the salivary glands are not spared. Elevated glucose levels compromise the microvascular blood supply to gland tissue, reducing resources available for saliva production. The saliva that is produced may itself contain elevated glucose, essentially providing bacteria with a ready meal directly inside your mouth. They flourish on it. So you have simultaneously reduced saliva quantity, potentially altered saliva quality, and an abundant food source for harmful bacteria. If you have diabetes and wake up with a dry mouth, those two facts are connected and both deserve closer attention from your care team. Sjogren's syndrome is another condition missed far more frequently than it should be. The gap between when people develop symptoms and when they receive a correct diagnosis can span years, sometimes a decade or longer. It is an autoimmune condition where the body's own immune system, for reasons not fully understood, begins attacking its moisture-producing glands. The salivary glands and the lacrimal glands that produce tears are the primary targets. The result is persistent dry mouth and dry eyes that do not respond to standard remedies because the issue is not hydration or environment. The glands themselves are being damaged. Sjogren's syndrome is more prevalent in women, particularly around and after menopause, though it affects men as well. Many carry this condition for years believing they simply have chronic dryness, managing symptoms without ever identifying the underlying source. If your dryness is persistent, does not meaningfully improve with hydration or environmental changes, if you also have consistently dry eyes, joint pain, or ongoing fatigue, a conversation with your physician about autoimmune evaluation is genuinely worthwhile. Other conditions directly impairing salivary function include Parkinson's disease, where neurological changes affect the autonomic signals controlling gland activity, rheumatoid arthritis, and other systemic inflammatory conditions, nerve damage from surgery or radiation to the head and neck, a common long-term consequence for people who have received radiation therapy for head and neck cancers, as well as HIV and other conditions affecting immune regulation. In each of these situations, dry mouth is not the actual problem. It is the messenger. And the message is that something deeper requires attention. Then there are the daily habits, the quiet choices that accelerate everything else and that people consistently underestimate because each one individually appears trivial. Dehydration is more prevalent among older adults than almost any other population, and the reason is not negligence. It is physiological. The thirst mechanism, the signal telling your brain you need water, becomes genuinely less reliable with age. The sensitivity of the osmoreceptors monitoring your blood concentration decreases. You can be measurably dehydrated and feel no compelling urge to drink. Your body is running low and simply not sounding the alarm the way it once did. If you are not drinking water consistently throughout the day, not waiting for thirst to prompt you, your body is making prioritization decisions with the fluid it has. It is stabilizing blood pressure, supporting kidney function, maintaining cellular hydration in critical tissues. Saliva production is not high on that priority list when the system is operating at a deficit. Alcohol deserves direct mention because its effect operates on two levels. It is a diuretic, compelling your kidneys to excrete more fluid than you are actually consuming. A glass of wine with dinner results in losing more water than that wine contained. That systemic dehydration directly reduces salivary output. Alcohol also produces a local drying effect on oral tissues. If you have a drink most evenings and then sleep for 8 hours, you are entering that night already somewhat dehydrated with already reduced salivary function, and then adding 8 hours of sleep to the equation. The cumulative impact on what you wake up feeling in your mouth is substantial. Tobacco use, whether smoked or otherwise, directly damages salivary gland tissue over time and alters the oral microbial environment in ways that compound everything already discussed. Caffeine is a mild diuretic. One morning, coffee is unlikely to be a major contributor on its own, but 3 or 4 cups distributed throughout the day combined with insufficient water intake and an evening drink can absolutely tip the balance. Heavily salted foods draw fluid from tissues. Acidic foods create an oral environment that saliva normally corrects. But when saliva is already depleted, it cannot correct fast enough. Now I need to tell you what happens when this goes unaddressed, because this is the part that changes everything. This is where that inconvenient morning symptom reveals what it is genuinely connected to. The most immediately dangerous consequence of persistent dry mouth is aspiration pneumonia. I want to explain this clearly because it is not theoretical, it is not rare, and the connection to dry mouth is real, documented, and consistently underappreciated, even within medicine itself. Aspiration pneumonia is a pulmonary infection that occurs when material from the mouth, food particles, liquid, or even saliva itself, is inhaled into the lungs rather than swallowed down the esophagus. Your airway and your esophagus originate very close together at the back of your throat. Every time you swallow, a precisely coordinated sequence of muscular events must occur in exact order and timing to direct material down the correct path. Your epiglottis closes over your airway. Your throat muscles contract in the right sequence. Your vocal cords come together. All of this happens in under 1 second, hundreds of times daily, entirely automatically. When saliva is insufficient, the material being swallowed is less cohesive, less predictable, and more prone to traveling the wrong direction during that split-second transition. In a younger person with quick reflexes and a powerful cough, material beginning to go the wrong way typically triggers an immediate effective cough response that clears it before reaching the lungs. As we age, that cough reflex slows. Cough strength diminishes as respiratory muscles weaken. Swallowing coordination becomes marginally less precise. The safety margins shrink, and when a food particle or droplet of contaminated saliva does reach the lungs, the resulting infection can be severe. The responsible bacteria, organisms multiplying in that dry oral environment, are pathogens that a healthy mouth keeps suppressed through the constant action of saliva, but that explode in population when that suppression is removed. When those bacteria reach the warm, moist, oxygen-rich environment of the lungs, they can trigger a rapidly progressing pneumonia. This is one of the leading causes of hospitalization and death in adults over 65. Not a remote possibility, a leading cause. And chronic dry mouth is a direct modifiable risk factor sitting at the very beginning of that chain. The second consequence unfolds inside the mouth itself over months and years of inadequate salivary protection. Because it develops gradually, it is the consequence people are most likely to dismiss until it becomes a crisis. Dental decay in the context of dry mouth is not the same as ordinary cavities. The rate is faster. The location is different, often at the gum line and on root surfaces rather than the chewing surfaces most people associate with cavities. And the extent can be alarming. People who have maintained perfectly healthy teeth for decades can experience severe deterioration within 1 to 2 years of developing significant xerostomia. The enamel that saliva was continuously remineralizing stops receiving repair. The acid that saliva was buffering sits against tooth surfaces for prolonged periods. The bacteria producing that acid are no longer swept away or suppressed. The conditions for rapid aggressive decay are perfect, and unlike an ordinary cavity that develops slowly and gives you time to catch it at a dental appointment, decay driven by dry mouth can progress from an early lesion to deep infection in a time frame that catches people completely off guard. From there, the consequences move beyond the mouth. Gum disease flourishes in a dry oral environment because the bacteria residing between teeth and gums are normally kept in check by saliva. Remove that protection, and those bacteria multiply, triggering inflammation in the gum tissue. That inflammation breaks down soft tissue and eventually the underlying bone. Teeth stable for an entire lifetime can begin to loosen. Even more critically, inflamed gum tissue is not a sealed barrier. A bleeding gum margin is a doorway. Bacteria from your mouth enter the bloodstream, and once in circulation, they travel. Research has linked oral bacteria to cardiovascular disease for decades. Specific pathogens have been identified within arterial plaque. Chronic inflammation from untreated gum disease affects markers throughout the body associated with heart attack and stroke risk. Oral bacteria have additionally been connected to cognitive decline. This is not fringe science. These are serious ongoing investigations. And at the origin of all of it is a mouth not properly protected, drying out night after night while the person sleeping assumes it is simply one of those things. In the most severe cases, a dental or gum infection can spread deeper into the head and neck or trigger sepsis. Sepsis is not the infection itself. It is the body's catastrophic systemic response to infection, a medical emergency carrying high mortality even with aggressive treatment. I share this not to alarm you, but to show the complete picture. Because what begins as a minor morning symptom can initiate a chain of consequences that are anything but minor. How far that chain extends depends on choices you make today. Dry mouth also transforms everyday life in quieter ways. Chewing becomes uncomfortable. Swallowing requires conscious effort. Mealtimes become a source of anxiety. People gradually stop eating foods requiring proper chewing. Steak, raw vegetables, apples, dense bread. They shift toward softer, more processed options. Over time, this produces nutritional deficiencies. Protein drops, fiber decreases, essential vitamins and minerals become inadequate, muscle mass declines, which in older adults directly elevates fall risk. Immune function weakens and energy levels fall. Every one of these changes increases vulnerability to serious illness. And then there is the social dimension. Persistent bad breath causes people to withdraw. They avoid close conversation, eat alone, and decline invitations. Isolation quietly develops, and it is entirely preventable. So what can you actually do? Hydration is fundamental, but not in large gulps. Salivary glands respond to steady, consistent hydration. Small sips throughout the day keep them actively functioning. Place water beside your bed. Sip before sleeping and immediately upon waking. Carry a bottle throughout the day. If you are over 65, do not rely on thirst as your guide. Use reminders instead. Oral hygiene must actively compensate for reduced saliva. Use a soft toothbrush and fluoride toothpaste. Brush gently for at least 2 minutes twice daily. Use a tongue scraper every morning. Floss each evening. Avoid alcohol-based mouthwashes as they intensify dryness. Instead, rinse with half a teaspoon of salt dissolved in warm water for 45 seconds. Chewing sugar-free gum or xylitol mints stimulates saliva production and reduces harmful bacteria. Crunchy, fibrous foods such as apples, celery, or carrots provide similar benefits. Your sleeping environment matters considerably. A cool mist humidifier meaningfully reduces overnight dryness. If you breathe through your mouth or have been told you may have sleep apnea, speak with your physician. Treating the underlying cause significantly improves oral health outcomes. Gentle morning massage of the parotid and submandibular glands before meals also encourages saliva flow. Daily habits directly influence salivary function. Alcohol, tobacco, excessive caffeine, processed or heavily salted foods, and acidic beverages all contribute to dryness. Consistently moderating these makes a measurable difference over time. Finally, professional guidance is essential. Speak with your dentist about salivary assessment, gum health evaluation, early decay detection, and available prescription options. Speak with your physician about which of your current medications may be reducing saliva, and whether alternatives or timing adjustments exist. If dryness persists despite consistent effort, prescription interventions are available, including medications to stimulate salivary production, prescription-strength fluoride, and advanced artificial saliva formulations. Your saliva is one of your body's most capable and tireless defenders. It protects your teeth, your gums, and your overall systemic health. What begins in your mouth reaches your lungs, your heart, your blood, your brain, and your quality of life. Each morning when you reach for that glass of water, your body is telling you something real. Today, you listened.